Rexulti is a newer antipsychotic medication that's available that is approved to treat schizophrenia, supposed to help treat major depressive disorder and agitation in cases of dementia. Now, this is a newer medication, so it's not really approved yet by many insurance companies, so there might be a challenge to get this paid for by insurances. Therefore, it's kind of expensive, and so I haven't really prescribed this often in many patients. But from what the pharmaceutical representatives have told me is that this is a good option for people who cannot tolerate like Abilify. This works similar to Abilify. And a lot of times in Abilify, people stop the medication because they feel like they're restless or jumping out of their skin. And so this may be a good alternative as a result. Now, it's thought to work by partially activating the dopamine D2 receptor, and it's also thought to partially activate the serotonin 5-HT1A receptor and block the 5-HT2A receptor. These dopamine, serotonin, norepinephrine, those are thought to play a role in major mental health symptoms and depression and bipolar and schizophrenia. And so too much dopamine in the front part of the brain is thought to play a role in hallucinations. Or too much dopamine in the emotional response in the brain is thought to play a role in psychotic symptoms and hallucinations. So by partially activating that receptor, a pharmacological term here is partial agonist versus full agonist. As you can see here in this graph, the full agonist will have a full response at the receptor, whereas a partial agonist will have a partial response at the receptor. So this medication has a partial response to the receptor, suggesting that the molecule dopamine is only going to have a partial response in the brain. And then dopamine, serotonin, norepinephrine, those are all thought to play a role in depression. And so this medication, probably by some sort of mechanism, which we're not entirely sure, helps to treat depression as a result. But you can't take this alone for depression. Usually you have to be on other antidepressant medications. And if the depression is not controlled, then you could add this one along with it. Now, there's several possible side effects that can happen with this medication, some serious ones, some not so serious ones. But for the most part, just like any antipsychotic, it can cause some weight gain, increased risk of high cholesterol, high blood sugars. It can affect the electrical activity of the heart. So the blood sugars, the cholesterol, those all need to be monitored periodically. Also, one's weight should be monitored periodically to see if they're having any weight gain from this. Also, long-term use of antipsychotics can lead to tremors, shakes, movement problems, which if caught early can be reversible and go back to normal. But if taken long enough and over a long period of time, then those movements won't go back to normal, and it just kind of persists. So it's really a concerning side effect. So be sure to keep an eye if you have any shakes or tremors in your arms, your legs, your mouth area, and let your doctor know if those are coming up. The dosing on this medication can vary. It can go to as little as 0.25 milligrams a day to as high as 4 milligrams a day. Depression or agitation and dementia is at 3 milligrams. The peak for schizophrenia is believed to be at 4 milligrams, and the dosing can vary based on one's age, their body weight, if they have other medical conditions, etc. I've had some people who swore that Rexulti was really helpful for their depression, and they swore by it, and they really like it, whereas for the most part, it's not used that often, mainly because it's a newer medication. Newer medications tend to be more expensive. Insurances want you to try cheaper medications before starting the newer ones. So hopefully that helps just in making a decision.